I had poor teeth most of my life, major problems actually. And I had recently moved here, and I went to my dentist for a routine exam, and he decided that I needed help. He referred me to TeethToday, where I met Dr. Samuel Sfaz, and after 5 minutes I just had enough trust to know that I was going to do this procedure. He promised me wonderful results.
A few years ago I was in a car accident and I lost all my teeth and a big chunk of gum, so I had to have it fixed.
I had heard about dental implants, but I never really knew that much about them, and I always thought it was a very complicated procedure, and I thought it was something that would take me away from my job for a long period of time, and I just never realized, how simple and easy it actually was until I came to TeethToday, and it was done in no time, and I was back to work after 2 days.
For many years I had dental hygiene problems, cracked dental work, gum issues, and temporaries. And I've been through a lot of different, I've tried several times to get it corrected. And it was always taking too long, and I'm very sensitive to pain. And the pain was always too much, and I would justify not going and finishing up the process.
I would talk to people like this, I didn't smile that much. I think you always know when it's time to do something, and I knew.
I felt nothing. I was put to sleep. I awoke. I had no pain. I had no swelling, and I had the most beautiful smile that I could ever dream of.
I was really nervous when I initially came in for the surgery. I'm getting married in a little under a week, but they made me feel really comfortable while I was here, and I'm happy that I went through with it, because
When I first came to the office for the first time, I was very nervous because having had such a bad experience over the past year or two with the dentures, I was really very nervous about what was going to happen. And after a few minutes here, I was just totally turned around. I was made very comfortable. Everything was explained to me in detail, and yet in terms I could understand. And I was raring to go, ready to move forward with the procedure.
Dr. Norkin explained the entire procedure to me slowly. He took his time, explained to me what we were going to be going through, what I would be experiencing, and gave me a great deal of confidence that I could get through this.
We had a consultation, and he told me what was involved, and they were so nice to me. I always was afraid of dentists. I mean petrified. But they made me feel so comfortable and actually made me feel at home. So I decided to go ahead with it, which I did.
With us now is Dr. Frederick Norkin. Doctor, so much amazing progress has taken place in your field of expertise. How do you help your patients today?
Well, with TeethToday, we're able to help patients who have either missing teeth or teeth that are soon to be missing because they're failing because of either extensive tooth decay or because of advanced bone loss, advanced periodontal disease. We're able to, using the technology from TeethToday, replace these teeth usually in a single visit.
How can you do it in one day?
What we know from science is that we can remove failing teeth and replace them simultaneously with new tooth roots, meaning dental implants. And at the same time, in many instances, attach temporary teeth immediately so the patients can leave here with teeth that are in place and do not come out.
How does a dental implant serve to replace a natural tooth?
Dental implant is very simply a new tooth root. By replacing that root portion of the tooth, we can then attach a tooth to it so that the patient can function, and many times immediately.
What is available today that can actually replace tooth roots?
We're fortunate that today we have dental implants, which essentially replace failing or missing teeth. Essentially, the dental implant acts as a new tooth root, and by using that new tooth root, we can now go ahead and attach new teeth that are fixed permanently, that don't come out, so that the patient can leave our office with teeth that are firmly in place. They can chew, they can function, they can smile, they can have confidence again.
What effect do missing teeth have on one's jaw?
When natural teeth are missing, the bone essentially resorbs away. It shrinks. The result of that is that it can become aesthetically challenging, and it can be challenging also to replace those teeth. However, using dental implants and the technology that we have today, we can oftentimes replace these teeth, helping to preserve bone, even when bone has been lost over the years.
What harm does that do?
When natural teeth are missing, the bone actually shrinks away. It resorbs, and this process happens rather quickly. It happens in a period as short as just several months.
What is the benefit of replacing one tooth with a dental implant compared with using the more common dental treatment?
When a patient replaces one missing tooth or several missing teeth with a fixed bridge, what they're essentially doing is involving other teeth in that problem. The advantage to replacing missing teeth with dental implants is that it allows them to address that individual problem with an individual solution. An additional problem with fixed bridge work on natural teeth is that if anything ever breaks down with those adjacent natural teeth, whether it's tooth decay or a root canal problem, typically the entire bridge has to come off and the entire process has to start again, often involving additional and sometimes even unnecessary work.
What are the problems associated with removable partial dentures?
Removable partial dentures are damaging the gum tissue as well as adjacent teeth. The metal clasps that are part of the removable partial denture essentially act to wear away, unintentionally, the adjacent natural tooth structure. They can also be quite irritating to the gum tissue.
What is a dental implant made of?
A dental implant, meaning a new tooth root, is made out of medical-grade titanium. The bone loves it. Essentially, the bone fuses to it like shrink wrap.
This is amazing, and you're saying the bone tissue adheres to the titanium implant and holds it firmly in place and can effectively support the teeth?
Because the bone fuses to the dental implant, it has a number of advantages. First of all, it helps to preserve the bone. Additionally, that new tooth root can now support new dentistry, new teeth for the patient.
What can the TeethToday Center offer patients who have one or several missing teeth?
Here at the TeethToday Dental Implant Center, we have spent literally decades helping patients who think that they've run out of options to replace failing and missing teeth, usually in just one day.
How significant a concern is periodontal disease and how it affects one's overall health?
For more than a decade now, medical science has proven that oral health and periodontal health directly affect our overall health. Specifically, our oral health and periodontal health affect the amount of inflammation in our body. From that, it affects our cardiovascular health, it affects our risk of Alzheimer's disease, our risk of strokes, our risk of certain endocrine diseases such as diabetes. It can affect pregnancies, and it can even affect whether or not patients develop certain types of cancers. Oral health has a dramatic effect on our overall health.
What is the concern regarding zinc and adhesives?
Zinc is present in a number of denture adhesives. This zinc can actually cause neurologic deficits, including tingling in hands and feet.
What are the benefits of using an all-on-4?
One of the techniques that we offer here at the TeethToday Dental Implant Center is the all-on-4. The all-on-4 is an incredible technique. Patients can come to our office either missing their teeth or with failing teeth and anticipate leaving our office with 4 dental implants, avoiding bone grafting, avoiding sinus grafts, and have a new, beautiful smile that's supported by just 4 dental implants.
Please tell us a little about the history of your center.
Here at the TeethToday Dental Implant Center, we've spent more than a decade honing a number of techniques that allow us to predictably replace failing and missing teeth for patients in just one day. We know that each patient is unique, and each situation is unique. The benefit to the patient is that it allows us to prescribe appropriate treatment options to them that are going to specifically match their treatment goals and desires. The doctors at the TeethToday Dental Implant Center have placed more than 20,000 dental implants, represent more than 40 years of clinical experience. All of our doctors are board-certified periodontists.
Thank you, Dr. Norkin.
My teeth look and feel natural. I'm able to speak perfectly. I have no impediments whatsoever. It's like I have my own teeth back again, only better.
If I knew how easy it was, I would have had it done a long time ago.
Yeah, when I left the office, I left, looked in the mirror in the car and smiled, and I said, I have teeth. It was great. It was immediate.
I am looking forward to the holidays this year because I have teeth and I can smile through the pictures and I don't have to worry about sitting down and eating something and being embarrassed.
I've had my new smile since 2003, and I feel fantastic.
As a producer, I had the privilege of completing this video for the TeethToday Dental Implant Center. And I must say, Dr. Jeff Ganellis and his excellent colleagues and staff absolutely do change the lives of thousands of patients from all over the world. It really is far more than cosmetics and appearance. And you know what? I should know, because I am one of his patients and he actually did save my life.
TeethToday is a groundbreaking dental implant procedure that offers patients an immediate return to their vibrant and healthy lifestyle in just one day. If you have any questions, please contact us at TeethToday. Thank you for watching.